right. Hi, everybody. Thanks so much for joining us today. My name is Nina Ignazik, and I'm the founder and editor of Planet Detroit. We are an online news organization launched in 2019. We focus on health and environment issues that affect Detroit and the region of Southeast Michigan. And since the beginning, we've covered the topic of lead paint. Continuously and extensively. And I'm really excited today to have two of the preeminent experts in our region on this issue with us today. So that's Diane McCloskey with with Get the Lead Out Detroit Coalition, and Dr. Teresa Holtrop, Executive and Medical Director of Kids Health Connections. And we're also hoping that Lashana Anthony, a resident who faced this issue, and her family will be joining us shortly. So thanks for joining us. And I'll just get started by allowing Diane to introduce herself, and then we'll talk a little bit about the map that's in front of us.
Good morning, and thank you, Nina. I'm Diane McCloskey. I'm also Executive Director of ClearCore Detroit, where we focus on preventing lead poisoning in children. And over the past 2 years, we have joined with 15 other organizations to create the Get the Lead Out Detroit Coalition. So we're very excited to launch that work and continue to find ways to help prevent lead poisoning in children, both by our individual work and leveraging the work of each other. I am chair of the coalition. Dr. Holtrop's also a member of the coalition, along with many other city, state, and local organizations. And this year we're focused on bringing families and community organizations into the fold as we grow the coalition.
Thanks for that intro. So Diane, this map that's in front of us kind of tells in a nutshell the story that we're facing, right? This is a map that shows it's basically a map of when homes were built in the region, and showing the percentage homes built before 1960. Can you tell us why that's important and what this map shows?
Certainly. So lead paint was outlawed in the United States in 1978. It was outlawed in other parts of the world as early as the 1930s, and in some places the late 1800s. But in the United States, it wasn't until late 1978, which meant that any house built after that time should not have been using lead-based paint, excuse me. The other part of looking at the age of the home, in addition to the fact that is it likely to have lead-based paint, is that the older the home, of course, we all know, the more condition issues there are. Even in a home that is well cared for, paint can deteriorate from friction of windows and doors opening and closing, as well as bubbling and peeling from moisture leakage and other things. So what this is really showing is while the darkest colors are in the general Detroit area, you'll notice that they also go to the inner ring suburbs. That just means we have a higher housing density of homes built before that time period. It does not mean that all of those other colors do not have homes with lead-based paint. This is not an urban issue. It is an old housing issue. So throughout the state and throughout the country, there are many, many, many homes that need to be looked at for this issue. You know, lead is toxic, especially in children under 6 when their brains are developing. And for pregnant women, children are crawling along the floor, they're putting toys in their mouth, they're touching everything and, putting their hands in their mouth. And so that really is making them most vulnerable to two things. One is lead dust, which is the primary source of lead poisoning in kids. And lead dust is nearly invisible. If you think about when the sun streams through a window and you see all those little particles in the air, I'm not saying that is lead dust, but that is how microscopic it is. It doesn't necessarily mean that you're looking at a pile of dust on your windowsill or floor, or that you're going to see a toy covered in dust. It is very, very fine. And the amount of dust that would be in a sweet and low packet, if you think about that and open it up and see just how little of the grains are in there, that's enough to poison a 1,500 square foot home. So it doesn't take a whole lot. So
Hmm.
we really talk about preventing lead dust in the home and also peeling and chipping paint because who would think that lead paint actually tastes sweet? So for
Hmm.
those kids who like to pick up things and put them in their mouth, once they taste it, they're going to put another piece in their mouth. So those are two of the main ways, in addition to exposure to lead and bare soil. And that just means your child might be playing out in the backyard and starts digging in dirt. That bare dirt, especially if it's close to the house where the house may have been painted in lead paint, may have lead leached into it. We've heard a lot about water, lead in water pipes. That is certainly a source, but it is not the main source. And then there's also lead in spices and cosmetics, especially from other countries.
Hmm.
Sometimes lead in toys that are manufactured in other countries. And then the silent one, which is family members who work in an industry where lead is used in construction,
Hmm.
um, radiator repair, many different types of industry, and they can bring it home on their clothes and their shoes and such. So, none of these are ways that anybody thinks of. I raised my son in the 80s and 90s. I never even heard of lead paint when he was little. So our real mission is to take this information and get it out to the world that this is preventable. We don't want to be causing hearing and speech problems, making it difficult for children to learn, slowing the growth of a child's body. We want to help children be as successful as they can. And so that's really why we're all dedicated to promoting education and asking everybody to also turn around and tell someone else. And I'll reference it several times during the webinar, but the coalition does have a website called leadoutdetroit.com. And there are all kinds of resources there for many of the things that we're talking about today about getting your child tested, getting your home tested, finding other resources on how to work lead safe in your home and clean lead safe.
Thank you for that. Dr. Holtrop, actually, I think we had one more slide. And why am I not able to move it? Oh, there we go. Okay. And so you mentioned this is not an urban problem, but we do know that the problem is prevalent in Detroit. And this data comes from a U of M study that found that about 1 in 7 Detroit families live in households that are in some way inadequate. Why is it so important to form the coalition in Detroit?
It's definitely important to form the coalition in Detroit, primarily because each one of the coalition members is specialized. So the health department is looking at helping kids get tested and helping with a response once kids find out they have families find out their child has an elevated blood lead level. Housing organizations are looking at housing condition and repairs. The state does some of the repair work in the city, but the city does other repair work. So there are a lot of moving parts and a lot of isolated pieces. And one of the things that we wanted to accomplish through the coalition is to get folks both from health and housing, education, and the medical field together at the same table to talk about ways to work together and also things that some of us can't do individually, either because we don't have the expertise or we don't have the funding, etc. So we're always trying to lift each other up, but then also look for what can we do that isn't being done now that we can do together and seek out funding. One of the reasons that Detroit has such a high amount of inadequate housing is the age. And also, we went through a deep recession, the foreclosure crisis, the tax foreclosure crisis, et cetera. And folks could get homes cheap. So they bought homes or bought homes to rent that were in pretty bad condition. And they really haven't brought them up to standards. So folks who don't have a lot of income are more likely to live in some of these substandard housing homes, and that is, immediately putting them at risk. The other thing is that we know, and I believe our speaker today might have had this experience, that
Mhm.
um, a lot of people don't know how to work safe. And
Mhm.
so if you are renovating a home and your children are playing while you're renovating it, or even if they're not there, there are things that you're doing while you are doing that work that are creating more lead hazards than you had to start with. So that's why we really feel education and outreach is so important, and why it's important for us to work together, and why Detroit desperately needed. We've had a lot of people, including Dr. Holtrup, who's been working on this issue for more than 20 years, and a lot of good work has been done.
Mhm.
But the fact of the matter is there's never a high enough percentage of kids getting tested, and there's never enough resources for home repair. And so we just want to continue to push the envelope and bring attention to it and get as many
Got it.
resources to the
I'm
problem
going to
as
go
we
a little bit
can.
out of order and jump to Lashana since she looks like she's joining us from her car and may not be able to stay on the whole time. Lashana, thank you so much for joining us. Lashana Anthony is a Detroit resident who I think was in much the same, much the position that you just described, Diane, where, she bought a home. For an affordable amount of money, but it needed a lot of work, needed to do that work, tried to do a lot of the work
Mhm.
herself, and ended up finding out that our son had been exposed to lead. So I'm going to bring up our story on Lashana. And Lashana, thanks so much for joining us. Do you want to just share a little bit about your history and your story with finding out your son was exposed to lead and then kind of what happened?
Oh yeah. Can you hear me?
Yeah, we can hear you.
Oh, okay, cool. I didn't know I have to. Okay. Well, thank you. Yeah, I did go through that. I did purchase a house that was very, very cheap, and it needed tons and tons of work, and um I didn't know anything about, really nothing about lead or anything. So when I did get into the house, I started like tearing down walls that, had lead paint on it and everything, doing, all kind of work, unaware of, that, there was lead in there. And then, we had to live in the house as I was doing it also. So it was, I think back at that time, it was probably a lot of lead just all over the house, lead dust and everything.
Yeah.
Um,
And so then how did you end up discovering that your son had an elevated blood lead level?
I end up, I end up applying for the lead abatement grant,
Hmm.
and one of the requirements is he if you have I think a child under 5 or 6, you have to
Hmm.
get them tested for lead, and it came back high when he got tested.
Hmm. And so then what happened? You'd never heard of lead before that. So what did you connect with? I know you connected with a parent group and the city health department. What were you able to do
Yeah.
to help your son? Yeah.
Yes. The health department ended up calling me after his levels came back, and yeah, I got connected um with the lead group, with the Wayne State and the city and everything, and I applied. No, they told me things I can do to get his levels down, just a lot of fluids and healthy eating and stuff. Yeah, and I applied. It did take a long time, but it came through, but it took a long time.
To get your house rehabilitated.
Yes.
Yeah, yeah. We were all trying to work with you as we were reporting this story to try to find out why it was taking so long to get you some of the funding that's available to rehab the house. But how are things today? So I know that you were able to do some of the work in the house.
Yes. The lead work is actually finished. They actually did my roof. They did my roof first because it was, leaks everywhere.
Mm-hmm.
Um, and then they worked on the outside of the house, and then they worked on the inside. So it is complete.
Got it. And how is your son doing these days?
He's doing good.
Yeah.
He's doing good. I think the last time they tested him, it was low. I want to say it was like a 3 point something, but it was really low.
Mm-hmm. So things are improving. Are you continuing to do anything to try to help keep his lead levels down or lower them further, just with eating or?
Yeah, I try to, yeah, I still try.
Mhm.
I haven't tested him. I need to, go test him again. So make sure, they low, still low or even lower, you know. I need to make him an appointment so I can get him tested again. But yeah, as far as now, he's okay.
Do people in your neighborhood and among your friends and family, do you feel like they're aware of this problem, or is this something that, most people still don't know about?
I think I think a lot of people still don't know about it.
Hmm.
Um, actually talking with some family last night that came over, a couple of family members, and we was actually talking about it last night, and they was just surprised at some of the things I was saying, like people don't really know about about lead.
Hmm. Yeah, I think that's a common experience. Well, we're so
Yeah,
glad that you were able to get your house fixed up and get the lead exposure reduced, and that your son's doing well.
yeah,
And
thank you.
yeah, so thank you so much for joining us. And if you, as long as you can hang on, great. I know looks like you're in transit, so we understand if you need to drop off, but we're going to be here for like another 40 minutes or so. Um,
Okay, I could be on for a little while longer. I have to get back to work in a minute, but I can be on a little while longer.
Thank you so much for taking the time.
You're welcome.
So next we're going to hear from Dr. Teresa Holtrop, who's worked in this issue as Diane mentioned for decades. Diane, what are we looking at here on this chart? This kind of tells a story of who's getting tested for lead, and then we have another chart that tells us, where the lead exposure is.
Did you want me to respond to that? You said Diane.
Yeah. Oh, I'm sorry,
Okay.
Teresa.
That's fine.
Dr. Holtrop.
Yeah, yeah. So this is actually the percent of all children that are being that were tested for blood lead levels in Detroit. That's the red line, and in Michigan, that's the blue line from 2010 until 2022. So the last 12 years. And you can see that the statewide, the percent of children tested is quite low, which is not really surprising because in many communities, lead is totally unknown. And therefore, I mean, I lived in the suburbs of Detroit when my children were little. And when I went to my pediatrician and said, please test my children for lead, because I live in a house that was built in 1965, he went, oh, you're going to have to go over to the hospital lab, which, meant me having to get into the car. And it wasn't something that they had available in the doctor's office easily. I went ahead and made sure I did that, but I know many parents who wouldn't even know to ask. And it was something that I had brought up with the pediatrician. So this is a pretty typical story for the outlying areas where lead isn't as much of a known hazard. Doesn't mean it doesn't exist, as was mentioned earlier. In Detroit, we've had what is now actually just recently went into law statewide, which is we've had universal testing, meaning every child age 1 and 2 years old should get tested for lead poisoning, no matter who they are, where they live. And in Detroit, that's something that the Detroit Health Department has been doing for years and years and years. But even with that universal testing guideline, you can see that we haven't tested 100% of kids. And it says dollars here.
Yeah, I
I
was
think
just
you
going to
meant
bring that up.
percent.
My apologies. That should say percent. That
Yeah.
should be a percent. Those
So,
are the
so
percent.
even in Detroit,
Yeah.
it was under 50% that were being tested at the height, which was in 2010. And the reason we were doing sort of kind of better than we had been previously was because right around that time was, I believe, when WIC started testing, many of the WIC offices started testing for lead, in addition to the testing being done at the doctor's offices. But you can see that over the course of the last few years, especially during the pandemic, there has been a huge drop off in how many kids are getting tested for lead poisoning. And I think, Nina, you have another slide, if I'm not mistaken, of the percent of children who've been found to be lead poisoned. Do you want to move on to that one?
Sure. Yep.
Yeah, there we go. And so remember, this is, you can see the red line in 2010, over 20% of the kids who were tested in Detroit were found to have elevated blood lead levels. And that has dropped down to somewhere around just under 10% of kids. But that's not only because there's been a drop in lead poisoning. That's really more a reflection of the fact that the testing hasn't been done. And there are a lot of kids out there, especially during the pandemic, when so many folks had trouble getting into their doctor's office, and that where the testing just simply didn't get done. So this is like one of the key messages that I think is important to get out there is parents, ask that your kids get tested for lead poisoning. The ideal way of doing it is having blood drawn from the vein, but in many situations, at least if it can be done as a finger poke, and before the finger gets poked, that the hands get washed with soap and water to make sure that there isn't dust on the finger itself that makes it look like there is an elevated blood lead level, but it's really, outside lead, not lead that's in the blood itself. Get that done, ask for it. If you have trouble making an appointment with your doctor's office, you might want to just call the doctor's office and say, hey, can you get the order into the chart so that I can go to your lab at a time that's convenient for me? Because I know for many, if they go to a clinic that is very, very busy for their preventive care services for their children, they're sitting there for a significant period of time. And by the time you're done seeing the doctor, you don't really have the patience, or maybe you have multiple kids with you and they're falling apart. And do you have time and energy to then go to the lab and have the blood drawn? That can sometimes be challenging, but at least call and ask whether the order for the lead can be put into the chart so that you can go at a time that's convenient for you shortly thereafter. And you just need to be sure that somebody is able to check what the level is. Nowadays with patient portals, a lot of times if a patient signs up for their patient portal, they're able to see the lead level themselves, what the result is. So I urge parents to do that wherever you are. Yeah.
Got it. So Dr. Holtrop, we've seen a bit of movement legislation wise in the state to address this issue in the last couple of years. I think Diana, you mentioned universal testing. Let's talk about that one first. What does universal testing mean, and how is it likely to impact those living in Detroit and the region?
Yeah, the universal testing means that every child age 1 and 2 years old gets a blood lead level drawn and measured. And it doesn't matter whether they live in a high risk neighborhood or community or not, they should all get tested. That is something that I think the state legislators were realized might be valuable in order to raise the awareness of lead poisoning, especially after the Flint water crisis. The Flint water crisis actually did a lot to shed light on the issue. But even before the Flint water crisis, we have had our own crisis in Detroit, and we continue to have our own crisis in Detroit that far outweighed what happened in Flint. Because we have so many older buildings, as was mentioned. So anyway, that's what universal testing is. It's now being implemented as the law of the state. And in Detroit, as I mentioned earlier, the guideline had been there all along, and most of the doctors do, the primary care doctors are aware of it and usually have a setup that allows them to get some testing done. However, it can vary. Some doctors' offices are able to do it right in the office setting. Their own staff draw the blood, send it out to the lab. Then some doctors' offices don't have that available, and they either don't have staff who are able to draw blood, or the lab is like sitting somewhere else, but within fairly easy distance. And so they ask families to go to the lab. Now, if the lab is right outside the door of the doctor's office, no big deal. But if the lab is even just 2 buildings over, or you have to get into a car to drive somewhere, then it makes it a little bit more challenging. And so sometimes low lead testing rates in certain doctors' offices are related to those factors. It's not that it doesn't get ordered, it's that it's not easy to obtain. And then the other problem is that oftentimes we have families who have so much other stuff going on that they just can't make it into the doctor's office. And that really impacts how many kids get tested. WIC was doing testing, had stopped doing it during the pandemic, but when they had switched over to virtual visits. I believe they're kind of edging closer to doing it again. I'm not sure if it has actually started already. Diane, you might know. I'm not positive. But in any case, I do know that that is not happening universally in all WIC offices in the Detroit area.
Got it. And so like right now, as of 2022, only about 15% of kids statewide and 25% of kids in Detroit were getting tested. What do you want to see that number climb to?
Oh, we'd like to get it to 100%.
Yeah.
We've never been above 50%.
Hmm.
Wow.
And so some of the ways to do that are just making the testing more accessible. Are you aware of any resources or programs that are trying to actually help with that implementation and make it easier for families to get that testing done and get to the lab or?
Well, I know that the Detroit Health Department does offer testing at their site, but again, it's a matter of going there. So that's one place that you can go. Um, Occasionally there's some mobile outreach efforts where there's a little machine, a lead testing machine. And I've actually been on some home visits where it was done right in the home. So we're trying to get more out there. I know the Detroit Health Department is working really hard to try and increase the lead screening rates. And Diane, maybe you can comment a little bit more of
Yeah,
what you've heard.
absolutely. I believe that they are looking towards getting the WIC offices reopened. You can call the health department, and that number is on our website, and book an appointment with them. One of the other things is that prior to the universal testing law going into effect statewide this January, like just last month, it was only children who were receiving Medicaid who were required to do it. So
Mhm.
through outreach and such, a lot of those kids were getting tested, but not all.
Yeah.
One of the things the coalition does is partner with different organizations to try to bring, if you're already having a health fair or some kind of housing fair or something for your neighborhood, we do have representatives from the state's lead program, the city's lead program, and testing facilities that if the uh, event is large enough, we can arrange to have. And then we are trying to have quarterly this year some larger events where we do have Lakeshore Legal Aid there in case you're having a problem with your landlord, the health department testing on site, the city of Detroit's planning and development department with their lead abatement program so that you can actually sign up on site to find or see if you're eligible for those abatement programs, and the state of Michigan as well. So we're looking to do more and more of that. And we're also looking to develop what I'm calling kind of our neighborhood network this year, where
Hmm.
we are trying to build a database of both block clubs, community organizations, faith-based organizations, healthcare organizations, and others who would agree to be on our mailing list. And then when we send out a newsletter or an event notice, that they
Hmm.
will then agree to reshare with their own circle of influence. And as part of that, we would like to also invite them to kind of a lead 101 so that different representatives in their leadership or others, because there's always grandmas and parents and just folks who care who want to learn more so that we can try to create more neighborhood advocates, because the information is there. It is preventable, but it goes kind of that health and housing go hand in hand. You have to get the kids tested, but then you also need to know, what to do if they do have elevated lead levels, how to lead safe clean in your home and how to do those lead safe repairs, or even hire lead safe contractors who know how to work lead safe. So it's really an important combination of all of those things. But that's
Mhm.
our main goal, is to get enough information out there and to create some, our events are not going to take it from 20% to 50%, but
Right.
every way that we can think of to make it more accessible for folks,
Mhm.
every child counts. And so everyone that we can get um, matters. We had one about 2 months ago. It wasn't a super well intended event. It was along with some other organizations, but we did have testing available at it. The
Mhm.
city health department was there. And of the three families that came in, there was about 10 kids, I think, combined of the three families. And eight
Mhm.
of them had elevated blood levels, including an
Wow.
adult.
Wow.
So, sometimes we love it when kids get tested. We don't love it so much when they're have an elevated blood level, but on the other hand, we do, because then at least we're connecting them to resources.
Right.
So, we would really encourage folks to contact us. Let us know when you're having an event. We're trying to create other events and get sponsors. We could get lots of resources there, but we got to get the bodies there. And so we've been calling them, lead poisoning prevention fairs and things of that nature. But we try to partner with schools and, any place that kids and families are going to be. So we are
Yeah.
always open to suggestions and partnerships. And, we just really want to keep that bar moving. It's a slow needle that we're moving. But, for every person that we reach, we hope that they're going to tell one, two, three, four, five people of their positive experience of preventing it.
Just like, Lashana maybe wasn't able to prevent it, but found out fairly quickly. I mean, how old was your son when you found out, Lashana?
He was, I want to say he was 2.
Yeah, he was very young and you caught it right, pretty quickly,
Yes,
fortunately. Yeah.
yes.
Um,
And
let's
that's a
talk.
super important point. The sooner you catch it, getting the blood levels to come down can take a really long time. And once it's in your system, and Dr. Holtrup can talk to this more, it's certain parts of it go right to your bone and are there, through your adult life as well. Teresa, maybe you can elaborate on that, as I'm not a medical professional.
Yeah. Yeah, if you have an elevation of lead in your blood for a long enough period of time, it doesn't just get pooped out, it also or peed out, it also settles into the various tissues in the body, and particularly in the bone is where it gets taken up, because lead acts in some way similar to calcium. So just like calcium gets taken up by the bone, if there's enough lead around, lead will get taken up. And then as you get older, and your bones start to, you go through the process of developing osteoporosis, et cetera, or say you're pregnant, for example, a pregnant woman, there's a lot of bone turnover during that period of lots of hormones acting on everything. That lead gets released again and has an effect. So um, yeah, I mean, it is one of those things. It's can stay in the body for a very, very long period of time.
Right. And so the sooner we find out, the better. Um, let's talk a little bit about another piece of legislation that is under consideration right now. It's a bit of a formality, but we've essentially tried to lower what the trigger level is for acting on this in terms of the elevated blood lead level. I think back in, was it 98? It was 10 micrograms per liter, and then it dropped to 5, and now the Michigan Department of Health and Human Services has adopted the Centers for Disease Control standard of 3.5. And now there's some legislation that would actually codify that. I think that's the word they're using, and make it kind of more formalized into the law. Why is it important to keep lowering that standard? Either one of you can answer.
I can answer that. So the what we when I was a resident back in the late 70s, early 80s, the level of concern that we had was actually 30 micrograms per deciliter, believe it or not.
Mhm.
And if you had a lead level lower than that, sorry, my phone keeps talking. If you had a lead level lower than that, we figured, oh, it doesn't really have much effect on the body. Well, many tests and careful studies have shown that lower levels of blood lead does have an effect on the brain. And those tests have gotten more and more sophisticated. And so then the elevated blood lead level of concern was lowered down to 10 micrograms per deciliter, as you mentioned earlier. And then in more recently was lowered all the way down to first it was 5 micrograms per deciliter and then down to 3.5 micrograms. And how they determine that is actually related. And we know that no lead is good for the body. The body does not need lead for anything. Okay. And it has negative effects. But at what point do you start saying, this is, it's something that we need to really pay attention to, is really related to a national study, a national survey called the National Health and Nutrition Examination Survey, or NHANES, that gets done once every 10 years. It takes about 3 years to collect it. It's a sampling of folks from all over the country. And it includes not just physical exams, and it's all ages, by the way. It's not just a physical exam, it's also blood testing for all kinds of things. Lead happens to be one of them. There's IQ testing that's done as part of it, et cetera, et cetera. It's really very comprehensive testing that's done through NHANES. And what this level of 10 was at one point was actually the 95th percentile. That means we're 95 out of 100 people were below, okay? And as we've done a better and better job in the country of lowering the average blood lead level, then it was lowered down to 5 micrograms because that was the 95th percentile. And more recently, it got lowered down to 3.5 micrograms per deciliter because that's the 95th percentile. 95 out of 100 people will have lead levels less than that. So what we're really trying to address is making sure that everybody has the same chance at having positive outcomes. We know that lead isn't good. Let's get it down as much as possible. How do we harness our resources nationally in order to get that level lower and lower? So you may see a further drop in the future.
Okay, I'm going to ask one more question, but I want to remind the audience that if you want, I'm going to open it up for audience questions after we discuss this next question. So if you would like to throw a question in the chat now or while we're talking, we'll try our best to get to all of those questions. But my next question and what I wanted to wrap up with is, what if you could have a magic wand and have all of the resources to tackle this problem, that you needed to actually move, this number up to 100 and number of kids with elevated blood lead levels, closer to 0, what would that look like? And are there any areas of the country that have this problem or other cities that are doing that work better than we are maybe in the region that we can learn from?
I guess I'll hit that one first.
Okay.
As far as other cities and regions, the coalition, we did research for about 2 years before we started the coalition and studied many other organizations in Cleveland, Toledo, Rochester, New York, Philadelphia, Pittsburgh, Chicago, Minnesota, and Wisconsin, and as well as some smaller other ones. And what we found is that while everybody is doing work to prevent lead poisoning, they're all doing it in different ways. Some of these are led by government coalitions. Some of them are countywide. Some of them are very specific to one organization. Some of them are statewide. Lots of good things happening. Nobody has the entire solution. So what we do is we look at health and housing as the interconnectedness. So I have 2 responses. Of course, having a ton of money for outreach and testing where we could do a whole bunch of other different things.
Yeah.
And education would be great. But on the other end of that, it's money for home repair. Not only, code enforcement, which is some of the things we learned about from other cities, and Detroit has some things in place and is continually working on it. There are so many homes, there's no one singular answer, and you have both the renter issue and the homeowner issue. The state has money for abatement programs. The city has some money for abatement programs. Depending which zip code you're in the city, one or the other works with you. But those programs have limited resources, and they do have long waiting lists. And the long waiting lists are just because the demand is so high. It's not because the work's being done too slow or anything. Some of that money comes from HUD, some of it comes from other sources. The number one source of lead dust in the home is old wooden windows and doors. And anywhere that wood or that there is paint, that opening and closing of it is causing friction. So in my dream world, and of course this would not solve it, but it could make a huge impact if we had a window replacement program that people could access. It would be huge, because that might be all that needs to be done. But more money in home repair and abatement is good. More money for staffing. The health department does a great job with things, but they could always use more money and more people. And the same with the state. There just aren't enough resources to address the issue. And there are a lot of people doing a lot of good things, but continuing to coordinate and getting more money both into the health side of it and the housing side of it, would start to move the bar. If we had a complete easy answer, it would be easy to say it, but it wouldn't necessarily be, we would always need to be seeking different types of funding depending what the strategy is. So we're going to continue to do that as a coalition, but it's a slow move. We're also, because there are so many different things happening, we've never been really tracking like the impact of outreach and home repair. So we're working on ways right now to start counting our successes as well. But with so many homes affected, it's a long thing.
Thank you. We'll let her recover. Dr. Holtrip, do you have anything you want to add?
Yeah, I mean, in my perfect world, we would be doing a better job of testing, but I agree 100% with everything that Diane just mentioned. If we didn't have the old housing stock that we're dealing with, we wouldn't have an issue with lead poisoning. As a matter of fact, there was a study years and years ago that showed that, I think it was Oakland, California, if I'm not mistaken, they simply didn't have as much lead poisoning, even though otherwise the population was very similar. And the reason was because their housing stock was so much newer. We in Detroit haven't had natural disasters that have caused us to lose large portions of housing, and therefore, causing housing to be rebuilt. So and we're also unique in as much as we are a very large geographic area with lots of single family homes. And so improving the housing stock, I think, is the key. And so I agree with Diane 100%. I do wish we did a better job of testing, but I think that is going to take a lot of, it's a multifactorial problem that needs to be addressed in many different ways.
Got it. Lashana, anything you want to add? In your perfect world, what do you want to see happen about this, if you're still with us?
I am here. um, I don't know. I guess just, people being more aware and, kids getting tested and stuff.
Got it. We're going to turn it over to did you have something else?
No, no.
All right. We're going to turn it over to audience questions now. How am I getting fed the questions? Do I need to look in the chat? Okay. All right, and that's our chat. How do I switch to all the chats? Sorry, everybody. I don't think I can see the questions.
I can see some of them. I might be all. one question I would like to address, somebody asks here, have we made any progress in the area of, let me see. Well, let's see, I'm getting these questions. What has happened with folks later in life who were poisoned as children? Have we done anything in order to address that outcomes for them? And there has been some progress made. We know that the brain is fairly flexible, and while lead poisoning prunes connections in the brain, which is why it has such a negative impact on learning, it's not as if just because you had lead poisoning as a child, there isn't a way of rehabilitating the brain. I mean, it's not that different from if you have a stroke as an adult and you then go through rehabilitation as an adult. We tend to focus more on the motor skills rather than on the cognitive skills, on the brain's, the learning skills. But it is possible. So if you have a child who was lead poisoned, I think it's really, really important that they get all the support possible, especially in the home. I would always tell parents of kids that were lead poisoned, are you reading to them? Are you reading to them every day? Because that makes a huge difference in their ability to learn new words, to new concepts, to learn to sit and just listen, talking about what is going on in the world around them, what's happening in the stories that they're reading, et cetera. That does a huge amount. I also think that the fact that, in past generations, kids frequently learn to play the piano or learn some instrument. And that in and of itself is actually helping the brain development. We don't do as much of that anymore. We learn how to tap our keyboards, but we don't learn how to practice the skills that we need for playing a piano. So there are absolutely ways of improving brain functioning. There's a one cognitive program that we had tested out at one point that improved working memory, which is sort of your short-term memory. And that we did it with a pilot group of kids who had had lead poisoning and had some really significant improvements. And so there are some things out there. We don't really advertise them very much. And I remember years ago, I was at a national conference and somebody said, we got to do more for kids with lead poisoning. And I remember folks from the National Institute of Environmental Health Sciences saying, well, we know what we need to do. We need to increase brain stimulation, and that helps every child. It's not just a kid with lead poisoning. So I think that's kind of key, and folks oftentimes forget about that.
Got it.
I see
Yeah.
another question that says, how can they tell if their zip code has been affected by lead poisoning?
So I can point you back again. I said I'd be mentioning the leadoutdetroit.com website several times throughout this. There is a resources tab within the website that has the zip codes listed and links to the city's a piece describing the city's program and the actual application. It also has a link to the state one. So my suggestion is look on the city one first. There's 16 zip codes that the city addresses. If your zip code is not on that one, then you go to the state application. But I do, and I saw several other things similar to that on there. I really can emphasize enough the leadoutdetroit.com website. Also, I think, Ruth, you had an organization that you're working with to do disability housing. For some reason, I'm only able to respond to the hosts and panelists in the chat. So I do want to encourage you. I did copy your link there to email me either through the website or through Detroit Lead Coalition at gmail.com. That's Detroit Lead Coalition at gmail.com. Also, if you want to join the coalition or learn more about events or just make sure you get put on the mailing list. But you can see on the screen there that we've broken the website down into a couple different areas. One is Get the Facts. There you can learn a lot about the sources of lead in your home. What does lead paint look like? etc. You can also view some videos in various places. We have Protect Your Child, which is about the things that you can do in your home, testing, etc. Lead in Housing covers more about how to work lead safe or hire a lead safe contractor, has links to the state's websites to find out who's certified. And then under Get Help Resources, we have state, local, and federal links there to help you find just what we were talking about, the lead abatement programs, how to get certified if you are a contractor who wants to learn more about how to work safely, etc. And then in our Take Action section, that's where you can join us, join our newsletter list, let us know about your organization, join the coalition. And if you could pause on this part, we are definitely, one of our latest things is we are trying to collect stories. We want to hear firsthand from folks like Lashana who have been living with lead poisoning. And a few of you have put a few things in the chat, which I hope that, Nina, you'll be able to give me a printout of that or something. But we're trying to collect these stories. One, because we want to learn from you. A lot of us work on the policy end, or maybe working directly with testing, so those folks are hearing stories, but they're not writing them down while they're busy working with the families. And so we want to learn as much as we can about not only when you first found out about it, but how it impacted your child as they grew up. I know one person had in the chat that they were working with somebody for employment. Um, because the more we can learn about the lived experience, the more we can look at things that supports that aren't out there. I mean, a lot of supports may be ones that you qualify for because of other issues your family may have, but we feel like there's a lot we can learn from each other. Perhaps different types of parent support groups, linking to other resources, but we hope that by gathering these stories, we can not only share a few on our website to encourage folks to take action because you did, but we can also look at them privately to just start to quantify real stories so that as we seek further funding and further partners, we can really put a face on this, because we work with the Michigan Environmental Council has a statewide coalition called MyELSH, and we work mainly on policy things, but we meet every year with legislators and their teams to educate them about lead poisoning in general. And often I get assigned, the ones in small rural communities or outstate who just think it's a Detroit problem. And that's
Mhm.
why I led off my talk today with, this is not an urban problem, it's an old house problem.
Mhm.
And it's not just your house. It's, are you going to grandma's? Are you going to an in-home daycare? Are you going to someplace else that might have lead paint? So the
Mhm.
more real people we can connect to this, the more we can try to move the bar and, motivate people to do more. So again, that's leadoutdetroit.com, and you can reach us at detroitleadcoalition@gmail.com.
Yes, and we will follow this up with an email with some of those links, as well as an invitation to sign up for Planet Detroit. So I just wanted to thank all of you, Lashana, Dr. Holtrop, Diane, for all of the work that you've done on this issue over the years, and sharing your stories and your experiences. We will be continuing to report on this issue. We're seeing the fruits of your labors now with some of this legislation and things that are changing to try to take more action, but clearly more needs to be done, so we will stay on top of it. Thank you so much.
Thank you. Thank you for having me.
And before we go, I just see Todd had posted about the Michigan Saves Lead Poisoning Prevention Fund. You can also access that through our website. Both landlords and homeowners can be qualified for that loan program.
Yeah, we'll send a link out to that as well. All right, everybody enjoy the rest of your Friday.
Thank you so much.
You
Yeah.
too. Bye.
Take care.